It's hard to know how long cancer has been tormenting humans, but in all likelihood, ever since we have been around. The first recorded description of the disease appears in the Edwin Smith Papyrus, an ancient Egyptian manuscript dating back to 3000 BC. Describes the growth on the breast and states that there is no treatment for the condition. The term cancer, which is ancient Greek for crab, was apparently coined by Hippocrates because of the resemblance between a tumor fed by blood vessels and the shape of a crab. He actually treated tumors either with cautery or cutting with a blade, but he noted that many were untreatable. Of course, when it comes to cancer treatment, there have been huge leaps forward since the time of Hippocrates, but still, cures are elusive. That is why today there's so much emphasis on prevention with hopes of reducing the incidence of the disease. But evidence for effective prevention is spotty. To be sure, establishing a causal link between smoking and lung cancer has reduced the incidence of lung cancer, and colon cancer rates have fallen with the introduction of colonoscopy, because of course that gives you early detection, and with the advice about eating more fruits and vegetables and less processed meat. But while overall colon cancer rates have fallen, that is not the case for young adults in the 20 to 40 age group, where the rate doubled between 2001 and 2021. Why this is the case is somewhat of a mystery. One theory is that the increase is somehow related to changes in the bacteria that inhabit our gut, the so-called gut microbiome. A study that detected a specific variant of E. coli bacteria in tumors supports this theory, since these bacteria produce colibactin, a toxin that damages DNA. What may have caused a change in the bacterial population in this age cohort is debatable, but suspicion falls on the diet. Perhaps the increased reliance on highly processed foods is a factor, or perhaps it is a stunning increase in obesity in this age group. Another possibility is the increased use of microbiome-altering antibiotics when these young adults were children. Obesity likely plays a role in another scary finding. The incidence of breast cancer in young women increased slowly from 2000 to 2017, probably due to better detection methods, but there has been a significant upswing since 2017. That parallels an increase in obesity. But another clue comes from the lack of a similar increase in breast cancer incidence in Hispanic women who tend to have more children and are younger when they have their first child. They also breastfeed longer. Diet may well be a factor here too, with the proliferation of processed foods again being scrutinized as a possible culprit. Alcohol may also come into play, since it has been linked with breast cancer and young women are drinking more alcohol. It seems Hippocrates was on the right track with his recommendation that food can be medicine, although he offered no advice of any practical significance except to avoid obesity. This, he believed, was a health risk and was preventable. Well, score one for the father of medicine. And that for today is our Cup of Joe.